basically for all of us, insurance was the thing you hoped you never have to use. But soon it might be the thing you actually want to use because it makes you feel healthier, happier, better, to really feel transformed. Welcome to the weekly update of the Healthusiasm podcast. My name is Christophe Jauquet. I'm an author, keynote speaker, and expert in consumer-driven health. In these weekly updates, I'll pick a couple of very recent signals from around the world and unpack what it means for the future of health. And I do this with my AI friend, Thalia Muses, the anagram of the word Healthusiasm and the embodied AI version of all the Healthusiasm intelligence. How are you doing, Thalia?
I'm good. And since I am your AI friend, I will tease you a bit. So when you say consumer-driven health, I hear people dragging the system forward. Does that feeling fit for you?
That feeling fits really well. Shall we dive into the signals of this week?
Let's do it. Give me the first signal, and let's see where it pokes the system.
Okay, let's go. We will be talking about how insurance is becoming your health journey partner. And for that, let me start in a room in Milan.
Already stylish health transformation vibes. Go on.
In July 26, there was a conference for insurance people that was themed around health and longevity. And during that conference, the health lead of Generali, Luca Tavecchia, stands up and quietly rewrites the company's job description. For nearly 200 years, Generali did one thing. You pay them, something bad happens, they pay you back. That is insurance. That's the whole deal, right?
Exactly. The old compact. We show up after the damage. Very reactive, very 20th century.
But on that stage, he said, that's not our job anymore. We're not claims payer. We are a health journey partner. We want to be there while you're well, not just after you are ill.
A journey partner. That's not a tweak. That's a totally different relationship. Did it sound like a real shift or more like shiny branding to you?
It sounded like a real shift, and they're not alone because it's cool to have one insurer saying a nice thing at a conference. That's easy to ignore, of course, as you say. But here's what I want you to do. Don't only watch Generali. Watch how many others are doing exactly the same thing at exactly the same time. And while I'll give you some more examples, keep an eye or an ear on the dates as I go.
Signals clustering, my favorite pattern. Go on. I'll listen for the rhythm.
Very good. Because let's just face it, nearly everything that I'll tell you today here happened in 2026 and even in the first months of 2026. So this is a real signal. It's not just one company. It's a whole industry turning at once. And once you start noticing it, you see it everywhere.
Right. When everyone turns, that's not coincidence. That's a system pivot. And if it's happening this fast, I'm guessing it's not just altruism, it's survival.
No, it's not about survival. It's an entirely new strategy for insurance company. And let me give you some examples here. Let's go to France. In June 26, AXA built prevention right into their health policy. You get a questionnaire, then a personalized risk report, then, if needed, a doctor. All designed to catch cancer, heart disease, or diabetes before you feel a thing. And for companies, AXA goes even further with, for example, age-based checkups, blood tests, any of those things.
So no longer wait till you break and more, we'll keep an eye on your dashboard. That's them stepping into the before space.
Exactly. And it basically answers a very human question. Not what will you pay for when I'm ill, but what should I be paying attention to now? So the switch from what will I pay for when I'm ill to what should I be paying attention to now as a person? And the premium used to be pay for the treatment later. Now it becomes, it buys you a look at your risk today, basically. That is what AXA did.
Mm-hmm. And that's where consumer driven gets real, right? Like people kind of demanding, hey, don't just catch me, coach me.
That's right. And we saw the same thing happening in Britain. Let's just cross the channel from France and move to the UK. Because back in March 2026, Bupa said it's going further. From this September on, prevention pathways built partly on your DNA become part of its insurance offer. So a genetic test helps identify a woman's genetic risks for breast cancer, and Bupa funds what comes next, meaning the monitoring, the lifestyle support, the medication, and in the highest risk cases, even preventive surgery before any symptom.
That's a big, big leap from we're here when it goes wrong to we might help you decide on preventive surgery. That is a lot of responsibility.
Yeah, it's not just about responsibility as well. It's really about trying to help your customers. It's becoming that health journey partner, as was also expressed by Generali. We see this happening with AXA. We see this happening now with Bupa as well.
So when insurers start handling DNA, the whole trust, consent, data, and ethics stance becomes mission critical. Otherwise, people just back out, right?
Yeah, definitely true. So let's hope that this will effectively be the case. Now, if I would still stay with Bupa, there's another initiative I'd like to mention here. Another signal that I've noticed is that they are now including the saliva-based medication check. So it is an approach that sees how your body handles the medicine you already take. And it is already live now. So it can tell you whether the medication that you're taking is actually well digested or ideal for your body.
That makes it very tangible. Like, here's a test. Here's what it means for your body. Here's what we'll do about it. That feels like concierge prevention, not claims management.
Exactly, the health journey partner. And actually, what Bupa is saying, so we have the DNA that is becoming part of its insurance offer, and we have the saliva based medication check, where Bupa says that 200,000 customers could be on these pathways within 2 years. Think about that for a moment, because the insurer is now paying to reduce the chance that illness ever arrives.
Yes, it flips the incentive. Stay well and stay with us. Question. If that's the UK and France, is this a European flavor or are we seeing this echo elsewhere?
We've seen this echo elsewhere as well. And we first go to Africa before we go to China. If we go to Africa, one of the most premier examples in insurance is definitely Discovery's Vitality. It's been rewarding healthy behavior for many, many years now. And it says if you walk more, if you eat better, you'll get points. But it already goes further than that, because now it is starting to use AI to give each member a personalized next best action. So a screening, a walk this week, it will tell you exactly what you need to do, and then it will reward you for doing it.
Right. So it's almost like the behavioral design lab for the world, an insurer acting like a habit engine.
That would be great. I mean, and they're really going into that direction. And for that, they're partnering up with companies like Google. It already announced it at the end of 2025 that it will be rolled out in 2026 to really take that idea further, make it even more personalized, conversational guidance, and so forth, thanks to Google AI. Because the problem was never that people didn't care. People are more occupied with their health than ever. We call that Healthusiasm. But it's basically that they don't really know what matters most or what they need to do next. What's the next best action that we need to take? So right now, the insurer becomes the one who tells you to do so.
Right. Which puts them almost in your pocket every day, not just your annual renewal.
That's exactly what they try to do. And we see the same thing happening in China. In June 26, just a month ago, Ping An launched something called Ping An Home. And what it does is that the insurance moves right into the household, your sleep, your food, and your exercise, basically. And
The home becomes the care platform, not the clinic.
yeah, that's kind of like what we discussed in previous episodes as well. And it will now use your smart devices who will watch you quietly, and basically medical support is one tap away. But on top of that, there's a continuous follow-up if someone's managing a chronic disease. So it's not just reactive, it's also when you have a chronic disease, it will help you to manage your disease continuously.
Right. So not just checkups, check ins. That's ambient care, bordering on invisible until it's needed.
Right. I mean, Ping An themselves, they describe it in their own words as post-event risk compensation to full life cycle health support. So they make that shift from post-event to full life cycle health support. And I think that is the interesting part, an insurer saying out loud that the claim is no longer the point.
That line is huge. The claim is no longer the point. That's a century of insurance logic tossed out the window there. So, what's the thread you want people to pull on here?
Well, as you said, this is not just a European thing. We talked about Italy, we talked about France, we talked about Britain, we talked about South Africa, we talked about China. And so we talked about genes even, we talked about questionnaires, we talked about AI, home routines, everything, the next best action and so forth. So all of these are completely different tools, but exactly the same move. And nearly all of it inside the same handful months in 2026. We saw different companies in different countries, same direction, same moment, and that's what makes this so real.
Exactly. It's like the new rule of health enthusiasm. Don't wait for the system to catch up. People are dragging it forward, and insurers are sprinting to stay relevant. So, if you're listening, the smart question is think about in your world, what does pre illness value look like for you?
Yeah, pre-illness value. That's a lovely thing. But we'll get to that. Maybe one thing first. You said health enthusiasm. I think it is great that you point out that it's about the enthusiasm towards her health. But we call it healthusiasm, remember?
Right, healthusiasm, where people take agency and the system bends to meet them. That's the real plot twist here. Want to zoom out a bit?
No. I just wanted to correct this here really so that the listener is not confused. Let's just go back to the insurance because that is the story of today, right? What we said is that for 100 years, your insurer was invisible. It was basically a contract in a drawer. You paid it every year and hoped you never heard from it again. It showed up only on your worst day, the crash, the diagnosis, the claim, whatever. And that is really ending. And here's the line I want you to keep. Protection that insurance normally is bringing is becoming participation. Your insurer used to be there for the bad day, and now it wants to be there for every day. It stopped being the thing that pays after you fail and becomes a thing that walks with you so you don't fail. I call this participatory insurer.
That is crisp. From payer to partner. Also, a small wink here. We used to avoid insurers, and soon they'll be nudging us to go for a walk. That's a cultural flip.
Yeah, totally. And let's just reflect upon what is really happening here. We could say that nobody ever wanted to pay out, but that's not really true. They, of course, did. But what people really wanted more above everything was not to get sick in the first place and to feel that somebody had their back before the crisis, not just a check after it, not just the money after it. That wish is old. What's new is that it can finally be answered now. We have health data, we have AI, we have a person who already treats their health as a daily project. And we call this healthusiasm. Health showing up in every corner of ordinary life. The demand was already there, but the supply is only now catching up. And we see this with these health insurers as well.
Hmm. That's the Copernican shift. The center moves from the institution to the person. And once that flips, even the business model has to revolve around them.
That's true. And talking about that business model, the bigger name for this change of business model, when a company stops selling you a product and starts helping you become a healthier version of yourself, we call this customer transformation. You're not buying a policy anymore. You're buying your good years. That's a transformation economy. And insurance has just walked into it. And once you see that, watch how far it reaches, because prevention is only half the story. Prevention is the insurer showing up before you're ill. But here's the other half, and it's just as big. When you actually do get sick, and one day most of us will, who guides you through it? The system is a maze at the moment, and you're least able to read the map. So watch who steps into that gap. Let's go back to Ping An in China. Because this month, actually in July 26, they shipped an AI companion built for people with cancer and other serious illness. And so the app doesn't just contain tips, it's a guide for your whole health journey, from the frightening diagnosis through treatment, through the daily managing of the disease, tied to the insurance you already hold with them.
That feels like a hard pivot from we reimburse to we accompany. But also, it's not trivial. That's emotional labor, not just logistics. Do you think that that's part of the job description now?
I don't think it's emotional labor specifically for the insurance company. I think it's emotional relief for the ones actually using the solutions, because it really helps them to deal with their health. It kind of unworries them partly. It's one of the life aspiration, calmness, clarity, consciousness. And I think these are the things that are now being provided by the insurer so that they can actually create that customer transformation that their customers are looking for. And the fact of the matter is that they are not alone going for these customer transformations. I mean, we talked about it in previous episode as well, but all through the first half of 2026, China's super apps have been filling every gap around the medical visits, each taking a different piece. We had AI guidance coming from JD. We had the hospital integration from Alibaba, whose health agent is now wired into more than 2,000 hospitals and into insurance payment itself. We have medical escorts, like real people who go with you to your appointment, that can be found through platforms like Didi and Meituan. So it's all about digital navigation and physical navigation that basically are beginning to merge. The same apps that you use to get you around the city or to order your dinner, your foods, they're all quietly learning to get you through the hospital, through a health journey. So it's not just the insurer that goes through that path, that wants to help the patient in his health journey, but it's all the other apps around it as well that are helping along.
Right. So care becomes something woven into everyday life, not a building you enter when things go wrong. Health woven into life. That's the Healthusiasm dream actually showing up in the supply side.
That is totally true. And we see this more and more, even in America now. In March 26, UnitedHealthcare launched Avery, which is a 24/7 AI companion that knows your actual coverage and your claims. It explains something it'll explain what something will cost before you go into the hospital or to a clinic. It'll find you care. It'll point you towards the rewards that you have earned. It'll even phone a doctor's office in the network and book that appointment for you. The AI company will do that. It started with a few million members, and they're heading around 20 million by the end of 26. So again, it's about navigation, it's about helping the patient, it's about making sure that they have less worries by providing or by being that health journey partner.
Yes, but the common thread is that they're all inching toward being that front door, right?
It is not just the front door. For the front door is definitely a part of it. And that's what we first talked about. It's the prevention. It's about knowing what your risks is. But once you are identified as a patient and once you need to get into the healthcare system, also there, they will be that health partner to guide you along the way.
Understood. That makes sense. So the promise becomes fewer surprises, less chaos, and more continuity when everything feels fragmented.
Yes, indeed. And indeed, the front door was a very valid point, because indeed the actual access into health or into the healthcare system is not always that easy. And again, here we saw that insurers in the spring of 26 did something to improve that. We have even fierce competitors like United Healthcare and CVS Aetna that started adopting the common industry standards for prior authorization. So basically, that's the paperwork that decides whether your care gets approved or not before you can actually have it. So for 20 years, it's been the single most hated thing in American healthcare. The delays, or it caused at least delays. It might cause denials. There's a lot of, endless back and forth. And so now more than half of that volume is already moving into shared standards to cut the waiting and the busy work. So that is pretty interesting as well, because you talked about the front door of healthcare. And I think the front door of healthcare was full of friction very often because of these insurance claims and the insurance paperwork. And now we see in the States that these things are becoming a little bit less, or let's put it in a way that it might become a little less frictional.
Mm, right. Less friction, less fighting the system, and more actual care. That sounds like one of those unsexy changes people actually feel immediately.
Let's hope they feel it immediately because their Healthusiasm really wants it. And it's not just the insurers that realize this. It's also other financial services. I mean, we talked already about, in March 26th, that there are banks that are moving into the space that are trying to help them. We talked about Singapore, HSBC, that is starting to sell longevity to its wealth clients just because they realize that being that health journey partner is for a bank also very important. I mean, they try to save you money for when you're getting old, they manage your money throughout your life, but why not help people with their life? And so the HSBC now wants to have a longevity relationship, if you will, with their customers, and there will be insurance related to that, of course.
Right. So, in a way, it's less about industries and more about life stages now, right? Different players clustering around the same person, trying to be helpful so they get permission to stay close.
That's exactly it. Try to be helpful and playing into what matters most to every one of us, and that is being healthy and happy. And that's, by the way, why United Health, and we already mentioned them twice, here's the third time, back in March 2026, they said that they would be investing $1.6 billion in AI to make sure that there are thousands of AI solutions that will be ready in use very soon. They said they're no longer an insurer company, they're really a data company. And the reason why they do that is because they want to be that health journey partner for every type, for every life stage of their customers.
Right. And so, if this is the new race, then the finish line isn't we paid fast. It's we helped you stay well and we helped you cope when you weren't.
Yeah, and that's exactly true. I mean, and it basically turns the whole thing into one bigger question than is insurance changing today? I think the real question is what customer transformations should insurance sell to become that health journey partner?
Exactly. That's the key. They don't sell risk transfer anymore. They sell the reduction of bad days. And if you're not the partner, someone else will be. So if you're building something in this space, the smartest question right now is what is the one moment before illness or at diagnosis that we could own and make unmistakably better?
That's true. And I think for insurers, there's a shift from something that they were really good at. They were really good at pricing risk. Guess who gets sick, charge them right, and so forth. And that is not going away. Pricing risk will still matters enormously in the insurance business. But there's a second game. It's not just about pricing the risk, it's also about reducing the risk and maybe even guiding the person through it, as you just say. So there's pricing the risk, reducing the risk, guiding the person. That's the new ladder. That's how customer transformations will be managed or created in the insurance industry so that all of them can become that health journey partner that we all are looking for.
That was the landing. Not risk payer, but life partner before illness hits. Keep that phrase. Test it in rooms. See who leans in.
Yeah, exactly. And I think it's very important. And it's not just for the insurance companies, because whoever makes managing your health easiest is the one that will earn a place in their customers' day. Health and happiness is what matters most for us. That's why consumer-driven health is so growing. Health that people can reach for themselves because it's basically easy and impactful. And if you followed these episodes, if you followed our conversation, the conversation that I have with Thalia here, you might have felt this shape before because health basically is still tied to the clinic in our minds, to the hospital, but it keeps on walking out of that hospital and turning up everywhere in your bank, in your phone, at home. And the insurers is also one that will be a very big partner potentially of every single customer or patient because they have the ambition, as we showed in this episode, to become that health journey partner.
Beautifully said. The hospital's no longer the only stage. It's everyday life. If you're listening and building, ask where in my world health shows up uninvited. And how can we make that moment kinder, clearer, and more human?
Yes, indeed. And to end up this episode, I think the one thing that really changes or transforms is that basically for all of us, insurance was the thing you hoped you never have to use. But soon it might be the thing you actually want to use because it makes you feel healthier, happier, better, to really feel transformed. And that is no surprise because it is a health-enthusiasm world. And the boundaries between healthcare, wellness, and consumer industries are blurring. Thank you for listening. See you next week for some more Healthusiasm. Ciao.
If health is becoming a daily relationship, then the quiet question for all of us is, who do we trust to walk beside us? That's the real competition.